Hello.
Hi, how are you?
I'm well. How are you?
I am good. I This is my first night of doing any Instagram live,
Yeah.
so I'm getting the jitters out.
Yes, I know it can be a little nerve-wracking, but I actually saw the last session. It was great.
Thank you.
So, very
Thank
informative. So, I was just letting the viewers know to stick around. We have some great topics that we're going to discuss related to food allergies. But I want to introduce you first. So, we have Dr. Kelly Cleary. She is, let's see here. So, I'm going to let you introduce yourself since
I'm
I'm sure you
happy to
can
do that.
introduce yourself better than I can.
Absolutely. So I work at FAIR, which is Food Allergy Research and Education, and I am the Senior Director of Education and Support Programs. I'm a pediatrician, so I did my fellowship in emergency medicine, but really in the past few years, I pivoted to mental health for teens, young adults, and adolescents. And I am a mom of four, and one of my sons has multiple anaphylactic food allergies. So I'm passionate about food allergies and educating about food allergies and just want to see our community safer.
Absolutely. So you work in it and you have personal experience with it with your child having food allergies. So I know that is definitely on your brain, the majority of the time. So I'm really excited about this discussion. So let's jump right into it. So this is just a Q&A session. So if you have any questions, definitely feel free to leave it in the comments. I'll try to get to them at the very end. But let's start with these questions. So as I was preparing for this live, I saw that the food allergy rates are the highest actually in Black, Hispanic, and Asian individuals, which I wasn't aware of that. And we also have the highest rates of severe allergic reactions and ER visits. So I really want to talk about food allergies as it relates to minority communities. So the first question is, what challenges do Black and Latino patients face with food allergies?
Well, I think that you just hit the nail on the head with kind of saying some of those stats, which I think are staggering. And when you see the statistics, it's something that demands change. So, Black communities are disproportionately affected in prevalence by food allergies, and you're right that the risk for fatal anaphylaxis in Black communities is the highest of communities. And I think when we look at this data, a lot of it really ties into social determinants of health and really looking into, what goes beyond, everything that we see. What about social, economic, housing, access to medical care? So we're seeing that in communities where, there may be underserved communities, the ER rates are higher for food allergies because patients are using the emergency room as primary care because they might not have access to a primary care doc. The access to allergies, like an allergist or allergy care, is decreased again because it's hard to access those docs. Where I think it really for food allergies I feel affected is the access to food. And I think when you look at a typical food allergic parent and family, it is estimated that food allergic families spend an additional $4,000 a year
Wow.
on caring for food allergies. And a lot of that has to do with allowing yourself to buy safe foods, that are safe for your child or your own food allergen. And so I think that that's something that, we really have to make sure that we're, really providing food for any child individual who needs it and has a specific dietary requirement, because that's something that, hearing that a child cannot have a food that doesn't have their allergen, I think is just alarming.
Yes, I definitely agree. The social determinants of health is everything, especially with minority communities. And, you mentioned buying groceries. With the price of groceries being where they're at, I know that's also an additional barrier in getting, the proper dietary foods, for someone's allergies. So yeah, that's definitely a big deal. So if you have any questions, please feel free to leave it in the comments. We'll try our best to get to them at the very end. But let's move right along. Next question. How can patients balance maintaining their cultural food traditions while managing their food allergies?
This this one is, I think, a really hard dynamic for lots of families with food allergies. Is balancing your culture and your family tradition, but then staying safe, which is the most important thing. So I think that first it's education and educating family members. I think sometimes it's really hard for some of our family members who have not been exposed to food allergy to understand the why. Why are we changing this tradition? Why do we have to do that? I think maintaining traditions or really focusing on traditions that might not focus as much on food are important. So, layering in that if there's something that your family does that is not, revolving around food, that making that something really, important and special. I know even for my own family, I come from an Italian family, and one of our biggest traditions is on Christmas Eve to cook a 7 fish meal.
Wow.
But then one of my 4 children is allergic to fish and shellfish.
Oh
So
man.
really getting that across to aunts and cousins and grandparents and telling people why it's important. And what we did was just really, again, focus on things that didn't have to do with food. We actually created a couple of new traditions, just to make things special. But it really came down to education for us.
Yes, education and knowledge, that's really power. Absolutely. I definitely agree. What resources are available for managing food allergies amongst underserved populations?
So that is hard, and I think that it does take a little bit of like diving in. We get a lot of emails at fair asking, I can't afford my epinephrine auto injector. What should I do? And that's a concern within our food allergy community as well, and one that fair is advocating to try to get those epinephrine auto injectors capped so that
Right.
patients can actually afford them. But really understanding the resources that are available. So we have a page on our website, and actually I run the teen advisory group. One of my stellar teens created a handout on all of the financial assistance programs that all of the epinephrine manufacturers offer. And
Amazing.
yeah, and they're out there. It just takes a little digging. I think for communities, if someone, is part of the WIC program, so Women, Infants, Children,
Hmm.
we really do a lot with WIC. WIC is, learning about food allergies. Sometimes they're the first, our WIC, service providers are the first people to recognize food allergies in a family. So really helping guide that, group to teach them about food allergies and understanding, and then also understanding what could be offered at school.
Hmm.
There's so much within schools that even at working at fair, I hadn't known previously that school lunches, those are very regulated, and if someone has a food allergy, you are entitled to a replacement that is
Hmm.
of equal quality and
Yeah.
all of the stuff that you would hope for. So again, it's about knowing where the resources are. But if you don't know, you can always reach out to someplace like fair, because we really do work hard to provide health equity within our community, because it's just so needed. And again, with disproportionate prevalences of food allergies in some of our communities, we really need to be fighting for this more.
Absolutely. I love that y'all provide those resources. That is just amazing. So if someone wanted to look into more resources, what website do they go
So
to?
foodallergy.org
Okay.
is where they would go. And I know that I offer my email, which is education@foodallergy.org. And
Awesome.
that's where we can really just direct people to the specific page. I, really do want any individual adult, child, teen who needs an epinephrine auto injector to have one. So we're happy to kind of help navigate that process, because again, epinephrine is what is life-saving in a severe allergic reaction.
Absolutely, absolutely. How can individual patients advocate for access to clinicians for diagnosis and treatment of food allergies?
So first again, when there is a lack of access, it is hard. But I think that really communicating your needs and finding anyone who will listen. So asking people in schools. We were just talking in the last discussion about school nurses and how important of a role they play in any child that has an ongoing medical condition. Asking your school, what are resources? Who else are people seeing? If you are utilizing the emergency department, at your discharge, ask, can you give me a referral to an allergist? And I think sometimes people don't realize that you can ask that question because you're leaving the emergency room, you've got discharge papers, you've got a prescription for the medications that you need, but really taking that one step further and saying, hey, can you refer me to someone who can manage my care? Because sometimes the way an allergist would manage the care is just very different and improves the quality of life of patients, who are receiving that level of care.
Absolutely. I agree. So just to clarify, if someone does have a food allergy, they should see an allergist, an allergy specialist, and not necessarily their PCP for managing that allergy.
So I will because there are places where people cannot get into
Okay.
allergists. So if your primary care docs, pediatricians, internists, geriatricians, they all can manage food allergy. But then the next level of food allergy with what are some treatment options that maybe are available and some newer approaches and newer diagnostics, that's when the help of an allergist will help. But my primary, concern would be whomever you can get that epinephrine auto-injector prescription
Mm-hmm.
from is the
Yeah.
right answer. So certainly your PCP can diagnose, treat, and manage your food allergies. But then that next
Mm-hmm.
level of what are the new therapy, what are the new things that are out there? How can I improve my quality of life? Are there better diagnostic tools? That's when I would say an allergist would be, really important.
Perfect. Yeah, that's awesome. And I'm glad there is more treatment out there, and I know that field is growing in awareness and studies. So I'm really happy that it's making some progress. So seeing an allergy specialist is definitely a way to go to discuss those options.
This is an
But this has been,
an
yes,
exciting
it
time for
is.
food allergy.
I agree. I agree. Thank you so much for
Thank
chatting with
you.
me. I really enjoyed this. I've learned some things myself. I hope y'all learned something as well. I encourage you to follow Dr. Cleary to the next segment. She'll be chatting with Jenna Gestinter, and she'll be uncovering a young adult's journey with food allergies and that from diagnosis to treatment, and the mental and social component to that. So definitely food allergy, follow the food allergy page for the next segment. And if you missed the segment, don't worry. I'm going to place it on my feed so you can watch the entire thing and all of the information that was talked about. But thank you again, and I will let you join the next segment.
Well, thank you, Amber. I enjoyed this. Thanks for having
Likewise,
me.
you're welcome. Have a great evening. Bye
You
bye.
too.